Come in.
Hello, my name's Jerry. I'm going to be your student nurse today. I'm going to shut the door for your privacy.
Okay.
And I'm going to wash my hands.
Alright.
And can you tell me your name, please?
Tyler Delavan.
And your date of birth.
April 20th, 1996.
And what year is it today?
2016.
Where are you at?
CHP, second floor.
And why are you here?
To get a physical examination by Jerry.
Patient is alert and oriented ×4. He appears his stated age. And he's overall groomed well. He's got no obvious odors. And there's no obvious signs of illness. And I'm going to perform a head to toe on you today. So do you mind if I touch your head real quick?
Nope.
Okay. Hair is dry, clean. There's no signs of lesions. If there were lesions, we would use the ABCDE scale to determine anything on it. And I'm going to touch your face if you don't mind. His skin is warm. His skin is normal for ethnicity and color. And his hair distribution is even. Do you mind if I touch your arms or your legs?
Nope.
Okay. His arms and his legs appear warm. Hair distribution is even. There is no obvious signs of scars or lesions on them. If there was, we would use the ABCDE model. And do you mind if I look in your eyes real quick? I'm going to shine a light. Just look straight ahead at me, please. And follow my pen light in, please. And his pupils are equal, round, reactive to light, and accommodation. And if you don't mind, his pupils are also even and symmetrical, and his nose is midline and symmetrical. And can I have you open your mouth, please? And his mouth, the teeth are all intact. There's no obvious cavities. His soft and his hard palate are pink and moist, so are his buccal membranes. Can you stick your tongue out for me, please? There's no coating on the tongue. And can you say ah for me, please?
Ah.
His uvula is midline, and his tonsils are 2+ equally bilateral. And now I'm going to listen to your carotid arteries. I'm going to listen for any bruits. And when I place the bell of my stethoscope on your neck, please hold your breath. Hold your breath. You can breathe. And hold your breath. And no bruits heard. And I'm also going to palpate your carotid arteries one at a time. Carotid arteries are 2+ equally bilateral. And now I'm going to test for cranial nerves number 5 and 7. Can I have you puff your cheeks out, please? And smile. And can you close your eyes for me and tell me where I'm touching you at?
Forehead. Right cheek. Left cheek. Chin.
Okay, cranial nerves number 5 and 7 are intact. There's no slouching or any signs of a stroke or anything. And then we're going to move to the lungs next. And can I have you sit up straight for me, please? And with the diaphragm on my stethoscope, we are going to listen into at least 10 spots. A couple deep breaths for me, please. Deep breath. Deep breath. Deep breath. And can I have you turn around for me, please? We're going to listen to 10 more spots on the back with the diaphragm. going to also listen laterally. Can I have you spin back around for me, please? Okay, lung sounds sound clear and vesicular. And I'm going to listen to your heart. Can I have you sit up, please? First, we're going to listen to the aortic, which is the second intercostal space, right sternal border. And then we're going to listen to the pulmonic, which is the second intercostal space, left sternal border. Then we're listening to the herbs, which is the third intercostal space, left sternal border. The tricuspid, which is the fourth intercostal space, left sternal border. And the mitral, which is the fifth intercostal space, mid-clavicular line. And here we would listen for 60 seconds for the apical rate. With the diaphragm, we would listen originally. And to listen for murmurs, we're going to use the bell of the stethoscope, and we're going to start at the mitral. This would be after the 60 seconds for the apical rate. The tricuspid, the herbs, the pulmonic, and the aortic. And no murmurs were heard. Now I'm going to do your upper extremities. Can you put your arms out for me and like that? And we're feeling for the brachial pulses, which are 2+ bilaterally equal. The radial pulses are 2+ equally bilateral. Can I have you put your hands up like this? And there's no clubbing present. And can I have you put your hands out like this? We're going to test for the capillary refill on all 10 fingers. And all 10 fingers refill within 3 seconds. And then can you squeeze my fingers, please? And grip strength is strong. Can I have you turn back around? I'm going to do your spine and your costovertebral angle. Bend over for me, please. Spine is straight. And I'm going to tap you in the back here. Let me know if there's any pain or tenderness, okay?
Mm-hmm. Nope.
And here.
Nope.
No? Okay, and now I'm going to have you lay down, please. We're going to listen to your abdomen. First, I'm going to inspect your abdomen for warmth. His abdomen's warm. There's no lesions or scars. His hair distribution is even. And we're going to auscultate in all 4 quadrants with the diaphragm of our stethoscope. Bowel sounds are present in all 4 quadrants. They are hyperactive. And now I'm going to percuss in each of your quadrants. And there is dullness heard over the liver, which is the right upper quadrant. In the other 3 quadrants, we would hear tympany. And then now I'm going to percuss. Tell me if you feel any pain or tenderness. Any pain?
Nope.
Any pain?
Nope.
Any pain?
Nope.
And any pain. Okay, in the right lower quadrant, we would have his right spermatic cord, his right ureter, and his appendix. In his right upper quadrant, we would have the liver, the spleen, the liver, the gallbladder, and the right kidney. In the left upper quadrant, we would have the left kidney, the stomach, and the spleen. And in the left lower, we would have the left spermatic cord, the left ureter, and the sigmoid colon. Okay, can you sit up for me, please? And there was no presence of JVD. Can I have you sit down around the edge for me, please? And we are going to assess for the popliteal pulse. Unable to detect the popliteal pulse. And now we're going to feel for the tibial pulse. The tibial pulse is 2+, equally bilateral. And we're going to do the dorsalis pedis, which are also 2+ equally bilateral. And I'm going to perform the Babinski test on your bottom of your foot. Can I have you lift this foot up for me, please? And I'm going to run the pen light to the left and towards the big toe. And towards the left and towards the big toe. Negative Babinski test. We're going to check for capillary refill on all 10 toes. And all 10 toes refill within 3 seconds. And can I have you stand up, please? I'm sorry, can you sit back down? There's one more thing we're checking for. We're going to check for the edema. And no edema is present. Stand up. Yes, please. And now we're going to perform the Romberg test. Can I have you close your eyes? We would have him stand here for 10 seconds to make sure he's not swaying. And you can open your eyes now. And can you walk to the window and back towards me, please? And this is the get up and go test. And the patient's gait is normal, steady, and no apparent signs of illness. And that would be the head and toe assessment.